If you're an employer or you're in the health insurance space, and I'm pretty sure you may have heard of an ICHRA, and maybe you're wondering, what is that? My name is Marlene, and I'm an ICHRA developer and a benefit consultant, and I'm here to help you answer that question. So let's get into it. So many businesses are frustrated with traditional group health insurance, and the reasons are lack of control over cost. God forbid there were to be a claim that year, which can rise up premiums when they go to renew, let alone trying to figure out if option A, B, and C will fit a multitude of their employees. Also think about how restrictive it must feel for their employees trying to figure out which plan out of the three best fits them. And the employer, last thing they want to do is be the one responsible for therefore picking the bad plans that their employees aren't even happy with. That's why an ICHRA really helps these employers, because it keeps them out of the decision-making chair, and it puts that responsibility back on the employee. And that way, when we sit down with an employer, hey, just figure out what you want to do as your budget, and the employee and myself figure the rest out. What is an ICHRA? ICHRA stands for Individual Coverage Health Reimbursement Arrangement. Please keep in mind, ICHRAs have only been around since 2020, so it is a fairly new type of way of offering health insurance to your employees. But it's one that's actually gaining a lot of momentum. A lot of employers are really favoring it because it helps them out when it really comes down to having more control over the type of healthcare they offer their employees and how it affects their bottom dollar. So unlike traditional group health insurance, ICHRA is actually tied to the marketplace. And the reason why that's more favorable is because when you think about claims and you think about how one claim, or maybe it was just that one claim that took you over and affected your premiums, now you have a much higher risk pool when you consider the marketplace. So unlike group traditional coverage where it's just with that one company, and I've seen this before with other people that I've sat down with where they just wish they could go to this particular doctor. Now through an ICHRA, it really gives that employee more control over who gets to have their coverage, whether it's company A, B, C, because now they get to see that one specialist that they've been hearing such good reviews from. So because it allows the employee to basically pick their own plan, and it removes someone else picking something for you and really giving you very limited options, that's why employees tend to really enjoy having an ICHRA. Now they can say who they want to go with, who they want to use their contribution towards, whether it's with this particular company or a different one. So it really empowers the employee. And they also can choose, well, if they want to pay a little bit more in their premiums, they're going to choose maybe a better plan versus there might be one employee who maybe only sees a doctor once a year and didn't really want to pay much at all. So it really empowers the employee over their healthcare coverage. So for any business owner right now that's wondering, how can I have access to an ICHRA? How can I get this started for my employees? And maybe you're having a hard time with the traditional group plan that you have. That's where I would come in. We'd sit down, we'd then build a strategy depending on what your budget is looking like. And because there's different things that we want to make sure we're hitting, such as compliance being one of them. And so I'm here to make that easier for you. We would build out a strategy. I would help implement the ICHRA and walk alongside your employees when it comes to choosing their health coverage. So again, my name is Marlene. I'm an ICHRA developer and a benefits consultant. So if you have any questions, feel free to drop a comment, reach out to me, and also, more importantly, like and subscribe.